Hi everyone, we'll now review how to apply our new PICC line dressings. So just remember that your setup, your opening of your sterile field, everything like that is going to follow the same guidelines as the previous video published on central line dressing changes. We're just now at the point where we've removed our patient's old dressing, we've applied our sterile gloves, and we're ready to commence with our new dressing change. So for your new PICC line dressing, you'll note that in the kit you have a separate dressing that's different from our central line dressing. And it looks a little bit different in the stabilization, which we'll go through at the very end. If you forget these steps and you're at the bedside, just remember that there's a handy guide on the back of this dressing that tells you exactly how to apply and remove the pieces of it, so that if you need a quick reminder, it's right there for you. So our preparation steps are going to be the same. We're going to clean with alcohol for 15 seconds, allowing it to dry for 15 seconds. We're then going to scrub with our chlorhexidine for at least 30 seconds, allowing it to dry for a minute to a minute and 30 seconds. We're going to apply our barrier film, which looks like this. Our barrier film prevents the dressing from causing any skin breakdown, and it also allows the dressing to stick a little bit better. And we're only applying that on the outside edges where our dressing will actually lie. We have this stabilization device that's going to be taking the place of the stat lock. So what you need to remember with this device is there's a picture of it that tells you exactly where the hub of the PICC needs to rest. So in this case, my PICC line is orientated up towards my patient's head. So I would need to rotate this and place it down as such. If I had a brachial PICC line and the PICC line was coming down my patient's arm, I would need to orientate this facing this way so that the hub of the PICC line rests where the picture describes that it should. So the first thing I'll be doing is placing my stabilization device down. What I want to do in this case is kind of map out where it needs to go. The prongs here are where my lumens are going to lie. We don't do anything with our little PICC eyelets anymore like we did with the stat locks. So just remember when you're marking your area to put this, or kind of mapping it out in your mind, you want to imagine the lumens going in these little brackets here. What we'll do is we'll take our sterile 4x4 and we can throw that over top of the PICC lumens so that we can touch the lumens and keep ourselves sterile. We need to slide this under here and place it down so that one lumen rests in the middle and the other one rests on the outside. We then need to take the lines and slide them underneath our little arm here. So it will end up looking something like this. From there we can release. We need to throw our sterile 4x4 in the garbage because the underside part of it is contaminated. From there, we need to peel off the adhesive backing on our stabilization device. So you're gonna hold down on one side. Remember, this is still sterile. You're gonna hold down on one side, and on the other side, you're going to peel the backing off using the little tab right here. So it should peel off fairly easily. If you're putting too much pressure in the middle, it's not going to come off easily. So just make sure you're putting pressure to one side. We'll stick that down, and then we'll do the same thing on the other side. Sticking that down as well. We'll buckle in our PICC line using our little seat belt. So we're gonna peel this backing off and press it over the top. The blue tab does not come off. That's there for the removal so that you have an edge to lift up when you remove the stabilization device after the dressing change has been completed and we're ready to put a new dressing on. From there, we'll apply our actual PICC dressing. So we need to remove the backing, just like with our regular chlorhexidine dressings. The chlorhexidine patch needs to rest over top of the insertion site. So we'll place it right there. We don't want to stretch the dressing, we're just placing it down. We'll tap down and get good adherence on our dressing. We want to massage it a little bit to activate the adhesive in the dressing. Press all the edges down, removing any wrinkles. And then we'll remove our border here and trace with our finger as we go. We need to save this piece. From here, we need to close off our dressing with the piece on the end here. So you can lift up here, there's no adhesive on that tab, you can pull it back. This needs to slide underneath the PICC line lumens so that we have a fully occlusive dressing. So we'll just snug that right up there. Again, we're not stretching, we're just pressing it down, removing any wrinkles. The backing comes off like so. And then lastly, we are going to write our date, time, and initials on this piece right here, and we'll place it over the front of the dressing. And this just seals off the front part of the dressing. And that is your PICC line dressing change.